Hello there, welcome to the world of Sustainable where academic internet. We don't come again, we will continue our lecture series under maternal and childhood. But this one will be just maternal and childhood, so I was trying to just nursing, but it's actually useful in maternal and childhood. So the topic today is the 9 quadrants of the abdomen or abdominal pelvic regions. So what's this topic about? This is a quick one, but not waste too much time because it's just like a way to speed up the learning process. So let's just go right into it. So first of all, the abdominal pelvic regions or the abdomen has can be divided into different parts. You understand? So sometimes you might call it the 4 quadrants, so for sometimes you call it the 9 quadrants. But for the sake of simplicity and to make it easy for assessment and also to help report certain parts of the body where probably a patient is experiencing pain, or to help in diagnosis or help in locating certain parts of the body, especially the abdomen and the pelvic region. This part is very, very important. The abdominal pelvic regions are very, very important. So we'll see that shortly. We'll use an example to make sure we drive our point. So this part is important because obviously as nurses, as doctors, as healthcare practitioners, we should be able to determine certain parts of the body where probably pain they come from, or they feel pain, or we try to diagnose something, or so on and so forth. So let's go right into it. There are 9 quadrants. Some texts will tell you, okay, there are 4. Well, this helps to give specific details to different parts of the abdomen and the pelvis. So there are 9 of them. The first one is the right hypochondriac region. The next one is the epigastric region. The next one is left hypochondriac region. The next is the right lumbar region. The next is the umbilical region. Then the next is the left lumbar region. And the next is the right iliac region. Then the hypogastric region and the left iliac region. So all these big grammar we talk about now, say all these parts or these regions are labeled according to the parts, specific parts of the body. You understand? So as to help aid memorization, to help you commit to memory. So I will feel remember sharp. So very simple. The name now, the hypochondriac region, it is that chondriac is related to the ribs. You understand? So it's related to the ribs, the cartilage of the ribs. You understand? So anytime you remember, if you want to remember this part now, this right hypochondriac region, from normally, if you look at it, the right hand side, you should know right hand side. Now right hand side is, if you're looking at the image, right is like the left on your part. You understand? So this part is the left, the other side is the right. Very, very important. If you know that quite alright, to remember this will be easy for you. You understand? So remember, this side is left, this side is right. You understand? So the right hypochondriac now region is showing that, okay, it is below the ribs, or below the ribs. You understand? So very, very important. Or is around the ribs. You understand? So that's it. And the epi now, gastric region on the other one. Epi means on top. You understand? Epidermis, so on top of the skin. You understand? The epidermis, that's the topmost layer of the skin. That's the idea here too. Epigastric means like on top of the stomach. You understand? Gastric means the stomach. So you can say that the stomach is around there. So to remember it easily, say, okay, this is where the stomach is. Okay, so this is really the epigastric region. And the other side too, same idea too. Left hypochondriac region. You understand? Because it's the left part and also around the kidneys. The ribs. You understand? So moving on, lumbar now. If you look at it very well, it is related to the lumbar vertebra. You understand? That part of the body is related to the lumbar vertebra. So if you remember it easily, just like, oh, lumbar. Okay, yeah, that's the part. So you understand? So the right, obviously, right lumbar region. You understand? Then the other side now is the left of the lumbar vertebra. Simple. Then the middle part now, obviously, that is where the umbilicus is found. You understand? The hair or the navel. You know, you can't leave umbilicus, you call it navel. So remember that's where that part is found. So this is the umbilical region. So the right iliac region now, you look at this structure here now. This is the ilium. In one of our lecture videos that we did earlier, you remember that we talked about the ilium as one of the innominate bones, you understand, of the pelvis. So this is the iliac, right iliac. That's obviously the right part, right iliac region. So hypogastric region now. So this is below the stomach. Hypo means below. You understand? So that's the idea. So the left iliac region on the other now. See, obviously the left part and also the left. That's the ilium. So that's why it's called iliac region. Simple. That's all. It's easy peasy. I've committed it to memory. You understand where and why they are called the names that they are called. Simple. That's all. You understand? And this helps to give you idea of what organs are usually found around those areas. You understand? Like this one, the right iliac region. That's where obviously the appendix is found. The epigastric region. This is where the liver is found. Even part of the stomach too is also found there. So that's the idea. Same with other parts too. And remember, this is diaphragm. It separates the thoracic region or the chest cavity from the abdominal region. That's why it is just indicated there. So moving on. Mnemonics now to remember this now. Very simple. So I would be quick about this. Simple. Right E left, left U left. Sorry. Right E left, right U left, right H left. That's all. Right E left, right U left, right H left. That's all. See, that's all. You understand? I see that you can see the different parts now, how it corresponds. That's all. You understand? So thank you. So to make this further clear, you understand, to make it clear for our head now, let's use an example, a question to further help understand this. So a 45-year-old patient presents to the emergency department with severe right-sided abdominal pain that began in the peri-umbilical region and has now localized. The patient reports nausea, vomiting, and fever. On physical examination, the nurse notes maximum tenderness with rebound pain in the right lower abdomen. In which abdominal quadrant would the nurse document these findings? A. You see the right lumbar region, the right hypochondriac region, the right iliac or inguinal region, or the hypogastric region. So for this lecture, I will not say the answer yet. So just if you know the answer, you can put it in the comment section, so you'll be able to access if you have understood what we have said so far. So thank you very much. We still remain sustained. Thank you for listening. Thank you for watching. Don't forget to subscribe. Don't forget to tag your colleagues, your friends, and don't forget to share to as many as possible. Thank you very much.